Welcome to Nikki Speaks TV, you guys, the relationship series. I cannot wait for you to meet my special guest, Dr. Sonya Reddy, cosmetic dentist who specializes in sleep apnea. You are in for a treat. Stay tuned. Welcome to Nikki Speaks TV, the relationship series. The pandemic forced us all to slow down and do an assessment of our relationships. Whether you're dating, engaged, married, or divorced, we'll share tools to help everyone. Join me this season as my guest and I talk about all things relationships. Welcome to Nikki Speaks TV, the relationship series. Dr. Reddy, why don't you introduce yourself and share with the audience who you are and what you do?
I'm Dr. Sonya Reddy. I've been practicing for over 15 years in the DFW area. I had 2 offices and just cut down to 1 right now. And I really believe in oral health contributes to your overall health. You can't put an unhealthy mouth in a healthy body. So I made that connection a few years ago and have not looked back. And we're mainly focused on cosmetic dentistry, also do a lot of sleep apnea solutions in our practice, and cutting-edge technology.
Awesome. Well, I just thank you. I know it's not easy, the line of work that you're in. And so tell us a little bit about what you specialize in and what are you passionate about with regard to your business?
I love that you asked. I think, started when I was a starry-eyed young graduate, graduated, and all I wanted was to have my own practice to kind of use my philosophies to treat patients and disease. And started with cosmetic dentistry because you actually improve smiles right away and have pristine smiles. So that was my specialty initially. And then I dwelled into surgery a little bit. And what we don't realize is a lot of stuff that you learn in schools, it's not enough. After having years of schooling and many years of, boards and all that stuff. But I feel like a dentist and a fresh graduate should, once they graduate, they have to really figure out what their niche is and kind of go there. So that's what I did. I dwelled into cosmetic dentistry, a lot of implant dentistry. I loved it. And then my grandfather 3 years ago passed away in his sleep with sleep apnea, undiagnosed sleep apnea. So I started really getting into that arena of sleep apnea and really studying what's going on. And it's a silent killer in America. And there's a lot of solutions that are not being offered to patients by medical physicians and ENT specialists. So I think, that's what really interests me. And that's what I'm really passionate about is to find solutions for people. People have pristine teeth, but they're coming in with TMD disorders, facial pain, and 20-year-olds are falling apart.
Oh, wow.
And they're getting prescribed CPAP machines at 20 to wear for the rest of their life. So
my goodness.
I started dwelling into every course there is to offer about sleep apnea, how to solve it. There was, so right now there is CPAP machine and there is surgery. And there is MAD appliances, which is mandible advancement devices. And so I really wanted to find the solution, which is more of a permanent than a temporary solution, and just started doing Vivos, which actually looks at your entire body as a whole. So I'm really realizing TMD is not really about just a joint, really. It's about your alignment, your gait, your posture, your nutrition. All of that stuff is getting into the realm of dentistry. And dentistry is really going into a medical field. And that's what excites me. And I really want to bridge the gap between interdisciplinary. We work with a lot of chiropractors. We work with ENT specialists, peds. So to reduce the disease and inflammation in the body.
Well, I love that you do that. And I love that it's more of a holistic approach, it sounds like.
Absolutely.
Which is needed, like you said.
People, I think, frown upon the word holistic. And they're always like, oh, this is some oil, that snake oil that we actually give you and say you're cured now. But it's really, I think, holistic to me is treat the person, don't treat teeth, right?
Yeah.
Don't just say, I'm just a dentist, I'm just going to treat the teeth.
Right.
Or I'm just ophthalmologist, I'm going to, treat the eyes. So I
Right.
think people have to really look at, okay, what is going on with this person? And a lot of us have subclinical symptoms. It's not enough to complain, but there's
Right.
ailment, right? There is, low energy, brain fog. They go to the doctor
Different
looking for a
symptoms.
magic pill. There's no magic pill,
Right.
you know?
Well, and I like that you said earlier, whole body. Do you feel that mental health is affected by, dental health? Is there a correlation there?
Absolutely. A lot of people that we see, which have TMD problems, facial pain, they're all fibromyalgic patients. They all have stress and mental health. So the first thing I tell them is go to a psychiatrist
Okay.
and actually manage the stress, because it is, as I said, interdisciplinary. So it is multifold symptoms and syndrome we have to correct. And, believe it or not, a lot of people have been living with so much pain.
Right.
You cannot just take the pain out and tell them they're healed.
Right.
It's a psychological, psychosomatic disorder.
I know you do a lot with, perfecting people's smiles and so forth. And this is a relationship series. And so I wanted to know, is there anything that you've seen, from your patients or something that you've dealt with personally that, you feel that, basically changed your smile or caused you not to feel the joy that you needed?
Absolutely. So many on a daily basis, actually. One such patient that she's so dear and near to me, she's a sweetheart. She had a partial denture. You know what it is? The teeth come in and out of your mouth.
Right.
So she had a lot of missing teeth. She didn't have good dental care, negligence. And so she had this partial, but she will never take it out in front of her spouse.
Oh, okay.
So they both came in because they wanted to have dental implants, and we did a little consult and a smile consult, and figured out, okay, she can get some dental implants, some veneers to perfect her smile, because she's such a sweetheart, but she said she can never smile because she's very conscious about it. So she could never show who she was, and people considered that she was grumpy. Like, even when she walked in my office, my staff we're like, oh my gosh, she seems very grumpy and she's unhappy. Because you don't smile, people assume you have that face that, you're very unhappy. But with me, she finally opened up and told me what she's, and, it kind of changed my world. And when we were finally able to give her implants, she did not let her husband see her without the teeth, by the way. So he would come to every surgery, sit outside. And when finally finished, she was so thrilled. Her relationship, she said she can open up to her husband a lot better, and she's got a promotion. I think when you're confident, it's you can't tell, like, it's not just one area that you excel in. You can excel in many, many areas, and you can't even tell. And so the only thing I remember her saying is, I wish I had done this sooner. I wish I had done this 15 years ago, 10 years ago.
Thanks for connecting with us today. Nikki Speaks Therapy is a platform that focuses on sharing tips, tools, and strategies to help you have a healthier and happier life. Follow us at NikkiSpeaksTherapy.com to stay up to date on all Nikki Speaks events. I'm so glad you're here. How do you motivate and encourage your patients? I'm sure, we had a sidebar conversation earlier, and we were sharing how, some of the things that we do, the services we provide, are similar in encouraging and motivating our patients, our clients, to feel better. So what do you do?
I think people are going to do what they want to do at the end of the day, right? They don't want to do it, they're not going to do it.
Right.
So I always believe in educating them, giving examples. Like just now, you asked me, give me an incident. I told them there's, thousands of examples where I can give, people because people think it's just misaligned teeth. It's not misaligned teeth. If you really look at the form that follows function. So if you have a proper TMD, with no problems, no issues, you're proper, you're standing straight, you don't have brain fog. So it corrects a lot of these things within the body, without proper posture. You never looked at a guy that's hunching and said he's confident.
I'm like, let me sit up now. We have the help of the pillow.
Right? Oh, okay. Like,
we all. Yes. I'm sorry. Go ahead.
You never look at them and say, or somebody that doesn't make an eye contact and smile at you, say, he's confident. You would never date somebody like that seems fidgety. You feel like he's hiding something, and they're not trustworthy. They come across as not trustworthy, but they're not so, So I feel like I educate them, I talk about, but more than smile, I talk about function.
Okay.
And, and when they see different people talking about it, our reviews, they will decide one day that they want to do it. I had such a patient for, I think, 4 years. He didn't want to fix a broken tooth back in the, back in the jaw. And my hygienist would talk to him. He would get so annoyed hearing it. And one day he came in, he had this lump sum money from his job. He fixed his broke a tooth, he did his veneers, and I think he was going through divorce, so he got like a new smile, everything, and he's like, Dr. Reddy, it's not that I didn't want to fix it. I knew I had to do it. I couldn't make time or finances right. And when I had it, I knew where I had to come and get it done. So, we all function in our own timing.
Right.
So
when you're ready, you're ready.
Exactly.
Let's talk about the age thing, right? Who's getting older? I don't know. But anyway.
Ages. To me, if you read this, I think How Not to Die, I think he says age is a disease. Age is a disease. We've accepted it, that we are diseased. But if you really do what you're supposed to do, tweak a little bit, add those amino acids, neurotransmitters, you don't have to age a lot.
That's exactly what I was
right?
going to ask you. It's like, what do you do
ahead.
when you start seeing changes? Because I know you do Botox or
absolutely, yeah.
Okay.
Botox, a lot of PRP stuff, which is natural again.
Okay, can you explain that?
Yeah, PRP is a plasma-rich protein.
Okay.
So what we do is we draw the blood and we run it in a centrifuge and we get all the rich collagen and the platelets and we deposit them and we inject into the face or as fillers, give you that youthful, it's like putting your collagen back is just super concentrated.
Wow, yeah, I think I've heard of that before. So you're using your own collagen.
Your own collagen. And you can put some growth factors in it if you really want to. And they're using that. There are many uses now. They're using that on their hair restorations.
Right.
Put some growth factors in it along with your PRP and 3 or 4 sessions. And I think Kim Kardashian called it the vampire facial.
Oh, okay. How funny.
But to me, I want to do something natural. I feel like all of our bodies are miraculous and we're able to heal disease naturally and decrease inflammation. So why not try the natural resource than looking for a magic pill out there, right?
Right.
So for example, grounding. I do grounding in the morning, is walk on grass, bare feet. What it does is it neutralizes all the ions that we're gradually accumulating throughout the day by oxidizing.
How long do you do it?
15 minutes, 20 minutes, or you can there's centers now, I think you can go sit in this like a blanket or a rug and it grounds you and neutralizes that. So there's a lot of books about how to not age and how to not die early.
Right.
And there's, about the appliances, the blue light, cut down the blue light, follow the circadian rhythm. I talk about a lot of that stuff in my podcast also.
Yes, tell us about your podcast. Tell us about your podcast because you have 2, right? You have one.
Yes,
yeah.
I have one. I'm started to do with my friend, fashion designer Ruby, and we talk about mind, body, fashion, how that affects your confidence, and how you project to the world. Because what you feel inside is what you kind of project.
Right.
And if you feel good, you're gonna you're going to do good and you're going to walk out there with that confidence.
Right.
So I believe in, no matter the age or whatnot, take care of yourself, right? Mm-hmm. Take that time. You probably talk about that a lot. Take that time.
I do. Different self-care practices, just to enhance your mental health. And, I know that with the pandemic, there's just been so much grief and, lots of loss.
Yes.
And then, maybe you can answer this or address this. Like with our masks, one day I was, wearing my mask and I was thinking, I'm going to smile behind this mask, even though nobody can see me because I felt like my face, for almost 3 years now.
Yes.
We're just in this stuck position as we walk around all day.
Yes.
So have you seen some negative effects?
Absolutely. I think people have postponed their dental care for number one. And some people have said, that is, they said that dental offices are places where they're getting a lot of, viruses, but there's not such reported because dentists are working closely with the mouth and there is corona and all that stuff.
Right.
There's not been, significant increase in that. But I think what it is when the natural smile, right? Mm-hmm. You can have this Botox smile, like you can completely plasticize your face.
Right.
I mean, Botox in optimal amounts is great, but if you completely make it plastic,
yes.
people, you smile, you're top part of the face is not smiling.
So it will be stiff, right?
You look fake.
Yeah.
People think you're fake, right?
Right.
But if you have those little wrinkles and you smile with your eyes, you see the genuine smile. You feel like she's kind, she's compassionate. So
show us how. You're so beautiful, but show us how to smile with our eyes. I want to make sure we're doing it right.
You're doing it right now. You're doing it. You know how our eyes become small, and you know, you got that wrinkles there, and
love my wrinkles. Is that what you're saying?
Exactly. Love them. Accept them. We can delay them, but you can't completely make them go away.
Hi guys, it's Nikki here, and I just wanted to encourage you to go to Amazon right now and purchase my book, Finding Your Voice Amid the Trauma and Drama of Everyday Life. If you or someone you know is going through something right now, an issue, a crisis, they're having trouble finding and discovering who they are, then this book is for you and it's for them. I cannot wait till you read it. Don't forget to like and subscribe and follow me on all major platforms at nikki.speaks. What would you say to someone that's listening that may be going through a tough time in their relationship, and they're looking for someone like you to seek out just a new persona, a new viewpoint of who they are, and a new face or a new smile? What would you tell them in terms of coming to see you? And
I think, you know, you probably talk about this a lot. We have problems with relationships and all types of relationships. It doesn't just have to be romantic relationships, right? If you just had a romantic relationship, a great romantic relationship, did not have good relationships outside of it, that does not enrich you. Right. So you want to have connections, and that's what COVID did that to us. It kind of like put us in this Zoom meetings and at home where we never had to dress up or go.
Right. Or at least, you know, the top part, we would wear pretty blouse with our sweats or whatever.
So I think it starts with, love starts with you. I always say that. Self-love and forgiveness. So you can probably attest to this, is when people are so critical about themselves, it reflects on other people.
Say that one more time. Somebody needs to hear that.
So, stop being so critical about yourself. I was like that. So I'm sitting here talking about it, but I was one of those, never appreciated my accomplishments. I would get there and be like, okay, what's next? And I never felt like I was really there. And I think I had to stop and take a mental note and step back and see, when I was 20 years old, I would have killed to be where I am right now.
Absolutely.
And for me not to be grateful or walk around with a face of disgruntled, material things do not make us happy. Money does not make us happy.
Absolutely.
So relationships will make you happy. So how you feel about you, as I said about the patient that looked grumpy, that she probably felt like that, right? But she has such a soft, kind heart. I could only see that after having conversation with her and really having her open up to me.
Right.
But you don't see that normally.
You don't.
And if you walk in grumpy, what are you getting?
Grumpy.
Exactly, right?
Grumpy equals
grumpy.
Yes,
exactly. And now you're like, there you go. There's another person walking in grumpy. I already had a bad day. So
it's all about your mindset.
It's all about mindset.
Yeah. And growth, as you were speaking, I was thinking of two things. How important is it to have gratitude? Like you said, looking back over all, how far you've come versus looking at how far you have to go. And I think sometimes we're so focused on the negative, what we lack, instead of, how far we've, all that we've accomplished.
I've read this book. I think it said we have about 8,000 thoughts a day, and 45% are negative.
Yeah.
And we can say here, no way, I don't think negative, I promise you.
Right.
All of us do. It's just a mental condition, right?
Right. And that same, I saw a study, and it's actually based out of Canada in 2019.
That's
and it said that we have up to 6,200 thoughts a day.
That's right.
85 to 95% were negative and repetitive.
Yes.
So I tell my clients that all the time, your thoughts really can predict your success, your mental success, your physical success, all of that. And so I love that you help people, not just feel good about themselves, but, change their overall health, through the sleep apnea that you are, really focused on now, and, bringing that to the community and all of that. So tell us a little bit more about that in terms of your mission, because I know that's a very powerful part of your practice.
Absolutely. I think sleep apnea, and I talk more about that because I can see all the signs and symptoms in the mouth.
Okay.
So during pandemic, I would have patients come in with 4 broken teeth or broken
Oh,
crown,
wow.
and aging process starts in the mouth. Believe it or not, you've probably seen, older generation people that have more. They show more of the lower teeth than the upper teeth, grounded teeth, straight lined, and teeth are broken into half, and that aging process, mouth ages us, teeth
wow.
age us. So
that.
to me, I talk about, breathing through your nose a lot more. And we are so.
Did you see I started doing that?
I know.
Everything you're telling me I'm doing.
My kids do that all the
I'm like-
time. I'm like, oh, who's hunching? And I tell one kid, and the other kid is like, what are you talking about? And mouth breathing is so, we don't recognize it, right? We chew gum throughout the day. What mouth breathing does is it actually increases your sympathetic nervous system, which is fight or flight. So that we
Yes.
carry at night, and we don't remember to close our nose, or we have some kind of obstruction going on in the nose, or allergens, right? There's so
Right.
much allergens right now.
Right.
So that, I think, puts people in this drive of like fight or flight and anxiety, constant anxiety. So that once you start, you probably heard everybody say, oh, if you're mad or angry, stop and take a deep breath, right?
Right.
Why do they say that? It actually improves your parasympathetic system. And actually, when you take air through your nose, you're not hyperventilating like you're in mouth. You're actually taking small bouts, and it's getting circulated properly. It's getting sterilized. It's actually putting nitric oxide, which is a relaxing, gas in our body,
Wow.
and dilates the blood vessels.
Oh, wow.
So you're actually feeling more relaxed versus not. And then imagine somebody in a fight or flight, tell them to be grateful. They will not sit quiet for 2
Right.
seconds. They will
Right.
like go, go, go. You know what I'm saying? So the responses are through amygdala, which is emotional responses. And they're like spur of the moment responses. So then, everything leads back to like bad relationships. They have a victim mindset, all that stuff. So I think, to my message really is for young dentists, I would say,
Okay.
I think stop saying you're just a dentist. Look for signs and symptoms in the mouth. And another analogy I love analogies because that's how I learn.
Absolutely.
Is teeth are your, kids in the family, and your head and neck is the family.
Okay.
You never had a dysfunctional, if you have a dysfunctional parents, you have dysfunctional kids. So if your teeth are grinding, you have issues with the teeth, look at your family, which is your jaw is a father, your musculature is a mom, and your head and neck is the household.
Oh, wow.
So if you have a improper posture, your musculatures are firing, improperly, and you have jaw joint clicking, what does dentists do? We always like note it down, say, oh, there's a clicking on the right side, thank you.
Right.
And they slap him with the night guards, and now you are sleep apneic. That means you're not getting enough air.
Okay.
And now you have night guard, so it's blocking everything. So it's actually making it worse. So I urge all the providers, not just the dentist. Don't ever say, I'm just a cardiologist, I'm just a dentist, I'm just an ophthalmologist.
Right.
Treat the person, not the disease,
That's good.
So-
I like that way of thinking. So I want you to look at the audience and speak to someone that needs to find you, and maybe is going through a tough time, and maybe doesn't have the finances, but is willing to at least start the process.
Absolutely.
What would you say to them?
I would say everybody seek out to providers that kind of reflect with you. I have a lot of social media presence, so I talk a lot on there, and of course the podcast is for you guys. So if you feel like something I said resonate with you, make an appointment. We do virtual consults as well. If I cannot help you, and I'm not saying all the solutions are in your teeth. I had a patient that come in, he had TMD issue, and he actually had to get an orthotic in his foot to correct his jaw issues,
Oh, interesting.
right? The misalignment can start anywhere.
Okay.
But at least go to a provider that will say, okay, there is a problem here, and I'm going to refer you to the right doctor. So don't ever be afraid. And I feel like more and more now, medicine has become personalized care, and it's up to you to really recognize and take care of your mind, body, and health, and not look into what is my insurance is covering and what is this. Go out there, read the literature, and find providers that actually align with you and go speak to them. There shouldn't be a charge for a consult.
Right. Well, I love that. Tell them how they can find you on social media, all the platforms.
Absolutely. So I'm Dr. Sonya Reddy, Dr. Sonya Reddy on Instagram, and my office is Smileup Dentistry. And you can find me on website, smileupdentistry.com, and Dr. Sonya Reddy on Instagram, LinkedIn, Twitter. I mean, we're everywhere now.
Right. Well, I'm booking my appointment as soon as I can. So.
I cannot wait. We're going to film it when you come in.
Yes,
How about
we're going to film it, guys. You'll be able to see my mouth and my teeth and all that fun
and she
stuff.
can talk about her experience. So people that are, I think in dental, there's two fears for people, fear and anxiety.
Yeah.
And
That's true.
when you come in, so they're always, like they told me, so many patients tell me, oh my God, it's not like the normal dentist appointment. I don't know if I should take it as a compliment.
You're friendly, you're sweet.
But, it's sad that they can't go to a dentist and feel, safe and serene in providing solutions. So don't be anxious, go and, there's different solutions for anxiety as well now, CBD and, nitrous oxide and all that stuff. So,
well, thank you so much for joining us today, and I just really appreciate you. You're such a bright light in the community, and thank you for all that you do for us.
Thank you so much for having me. I had such a good time.
Awesome, guys. Well, thank you for joining Nikki Speaks TV today, the relationship series. I'll see you next time. Thank you all for joining my show today on Nikki Speaks TV, the relationship series. Follow me on Instagram, Facebook, TikTok, and Twitter. Don't forget to like and subscribe on YouTube, or you can visit me at nikkispeakstherapy.com. See you next time.